Hello, my name is Dr. Philip Mease. I'm a rheumatologist based in Seattle, Washington. I direct the Rheumatology Research Division at Providence Swedish Medical Center here in Seattle and conduct clinical practice in rheumatology. When a patient comes into the clinic, either for the first time or well down the road along the way of treatment, they, of course, are interested in getting rid of pain, getting rid of stiffness, getting rid of fatigue that besets them from having a chronic autoimmune disease like psoriatic arthritis. But one of the key points that they bring up very quickly is I can handle the pain. I can handle fatigue to a certain extent, but I am not wanting my joints to have progressive structural damage. They don't say it in quite the same way. They say, I don't want my joints destroyed. Uh, and the uh, and then they'll throw in a phrase like, I want to be able to play with my grandkids in the future. I want to be able to do fun activities with my family. I want to be able to do my work without having to be concerned about my lack of physical capability of doing so. So it's that structural damage piece is really of paramount concern to the patients that we see. So when a drug is being developed for treatment of psoriatic arthritis, one of the key things that we have done from trial after trial after trial is to assess whether or not the drug is capable of inhibiting progression of structural damage. And this is typically measured by obtaining x-rays of the hands and feet and looking for evidence of either joint space narrowing or what are called erosions in the bone immediately adjacent to the joint area. These are the two key features that we're looking for when we're measuring by x-ray whether or not damage is present and is there any advancement of that damage during the course of a trial. So the typical method that this is done is something called the Sharp-Van der Heijde uh, uh, score, which grades joint space narrowing and erosions. And many of the drugs, if not most of the drugs that we have in our armamentarium for psoriatic arthritis, have had this assessment done at least once during a development of a drug, typically in phase 3. And most of the drugs that we are working with have been able to demonstrate inhibition of structural damage progression. This was first looked at uh, with Tremfya in their pivotal phase 3 trials. Uh, uh, and in that, the trial that was known as Discover 2, which was a biologic naive population of patients, meaning they hadn't been treated with biologic agents before. Uh, 2 doses of Tremfya, one given on a monthly basis, one on an every other month basis versus placebo were tested. And what was demonstrated in that trial was that patients who were treated on a monthly basis did show statistical separation from placebo, but the patient group that was treated once every 2 months just missed having a statistical separation from placebo. So this did not allow for the FDA to give Tremfya as part of their label the ability to inhibit structural damage progression. Meanwhile, for example, with other IL-23 agents, there too, they were not able to discriminate from placebo.